right now, I just transitioned here. A week ago was the opening of my comprehensive exam period for my PhD. So this week has been fairly busy. So my PowerPoint's fairly plain and fairly brief, but I want to have it be a little bit of a discussion as well, and then open it up to some questions at the end. I never find it's that great if you present it all and then leave everybody hanging without being able to ask questions. So I've got 2 more weeks to compile a 15-page literature review on something that relates to what I'm talking about tonight, as well as a 15-page research study that also relates to something similar to what we're discussing tonight. So this is a good test to see if I know what I'm talking about as I prepare for this literature.
So are you saying we should ask good questions and give you some good ideas for your paper?
You can ask good questions, yeah, as I do this. A lot of the literature review has to, I have to cite straight from the literature and kind of make it a narrative review of the concept that we're looking at. And the concept of the literature review was talking about aging and what is the normal system like, and what is system in normal aging. And so we had the chance to look at this from either the musculoskeletal, neuromuscular, cardiovascular, bone health, and mineral perspective. And I've elected to look at the neuromuscular components involved with aging. So we'll be hitting on a little bit of that during the session today, and how that relates to physical activity and exercise as well. As we move forward, thinking about physical activity and health, I'll discuss why I'm calling it physical activity and not necessarily exercise specifically as we get through some of the presentation. So I adapted this presentation from another presentation that contained a lot of the similar information as I was organizing this content. So let me see here. Yeah, sorry, there we go. So again, this just bounces off of some of the objectives that we had for the goals for tonight. But specifically kind of developing an understanding as well for the body's normal response to aging, at least at a broad level, and how physical activity can impact some of these natural changes that occur within the body. So when we consider physiologic changes with aging, specifically, I'm looking at kind of what happens in the muscle. Okay, and so there's a term that was kind of thrown out in about 1989 called sarcopenia, and you've probably heard the term sarcopenia, which was originally defined as an age-related loss of muscle mass. Okay, it was more specific to mass itself. But what researchers were looking at was, does muscle mass necessarily correlate with strength or function? So over the past 30 years, this has evolved, and within the last 10 years or so, they've kind of developed a more operational definition that looks at sarcopenia involving the loss of muscle mass, but also strength and function. I'm not gonna carry on too much about sarcopenia, but that's one of the I say underlying topics that is going to relate to what we talk about with aging. So, as you can see, with normal aging, and usually after the 5th and 6th decades, this begins to happen and accelerates as we get into the 7th, 8th, and 9th decades of life. And so we see usually a decrease in muscle mass and power, decrease in muscle strength and endurance. There's also a decrease in contractile velocity, as well as a decrease in muscle mitochondrial function. And part of this relates to the neuromuscular system itself. So the changes in muscle mass, there's a lot of interrelationships with a lot of other body systems on loss of muscle mass. And there's always that question of the chicken and the egg. What came first? Did the muscle start to decrease in mass, and so we started to lose connectivity with our motor neurons, or did the motor neurons start to degrade over time, which is normal with aging, and as a result, less muscle is connected to the neurologic system, and therefore starts to decrease in mass as well. So it's kind of a, what comes first, and that's where researchers don't really know, but we know that there's relationship there. So along with those that I listed there, other physiologic changes that we can experience with aging that relate to physical activity and exercise and health are decrease in maximal and submaximal aerobic capacity. And this is essentially, if you were to go for a run, you're not going to be able to do it at the same pace as you did, when you were 22. I even figured that out when I started running again after many years last week, and I was trying to go faster than 8-9 minutes a mile, and I said, why can't I do this? It happens, and that's normal and natural. There is some training effect that can be involved that we'll talk about a little bit later, but we also see some decrease in cardiac contractility, as the heart is also a muscle and innervated by nerves as well. Decrease in maximal heart rate. There's a equation, it's usually 220 minus your age as your kind of maximal heart rate. So that's something to consider. You can all calculate, what's 220 minus your age, and that's about what your kind of maximal heart rate would be expected to be. We're not going to be expecting that you exercise at your maximal heart rate. Okay, that's a little unrealistic. Even I would say weekend athletes don't necessarily do that. But moving along, there's also a decrease in nerve conduction velocity. That just means how fast does the impulse from what your brain is saying get down to where it's going, okay? And that specifically relating to maybe a more volitional type activity. How fast can you contract your muscle? How fast can you move? So it's kind of the hyperspeed highway for information from your brain to your nerves. It also works the opposite direction. Your brain sends messages through your spinal cord, which then send messages to your muscles, right? On the flip side, if you were to touch something that's hot or get pinched, your sensory receptors within that area send the message back up to the brain and is interpreted into the brain. It goes to the spine, connects to another nerve, and runs up the brain. So those can be reduced. One thing that we talk about a lot is balance, right? So balance can be impacted specifically with aging. And all of these, you can tell they're global, but they probably relate to specific subsystems and a combination of subsystems that I'll have listed a little bit later. Proprioception, that's a big word, which means kind of being aware of where your joints are and your body is in space. Kind of knowing that you're starting to tip too far to one side, or if you're starting to lose balance, or in a lot of patients that I have with neurologic impairment, I could move their foot and they might not be able to tell, is it pointed down, is it pointed up? And so sometimes this we'll notice more at the big toe. The ability will point the toe up and say, is it up or down? And then we kind of reset. Okay, is it up or down? And then we test for proprioception, because that directly, again, then relates to balance. If you start to tip, your big toe is one of those sensors that can tell you, oh, I'm going a little far forward. But if we lose some of that proprioception, your ability to adjust your center of gravity and your balance is delayed. So therefore, you're a little bit further into that lean before you catch it. And so that can impact balance and fall safety as well. Gait speed and stability. It might be stereotypical to think you see somebody who's 95 and they're just making their way along, and that's just fine, and it's part of normal aging, but we want to make sure that it's also safe. So gait speed is typically reduced normally in aging, as well as the stability. Stability goes into balance, but gait stability itself, and that's where you may be looking at using a gait aid, a walker, a cane. That's a lot of my business is trying to figure out how we can make people safe to mobilize, especially while we're rehabbing, and maintain safety while trying to gain back some of the natural speed and stability. A couple other things too: decrease in insulin sensitivity, immune function, bone mass, strength, density. This is where osteopenia and osteoporosis come into play. There's a lot of research in osteoporosis, and if you're familiar, from a basic perspective, weight-bearing activities helps improve bone mineral density. The muscle contracting also helps facilitate bone strength. And so if we're on one side having a reduction in mass of muscles, and we're having a decrease in activity, we're also going to have a decrease in some of that bone health as well. There's lots of, vitamin D is really important, especially in females and with everybody during aging. That can help with some of that. But again, it's also a natural part of aging. And so there's lots of other things as well. I don't have them all listed. This isn't all encompassing. But we do see increases in arterial stiffness. Now, it doesn't necessarily mean it's a good thing. Your vessels are typically pretty robust and flexible, but as we age, it gets a little stiffer, which can cause some difficulties in the ability for your body to manage its blood pressure. Sometimes there's increases in your systolic blood pressure, which is the top number, as well as the bottom number, diastolic blood pressure. And I'm not a nurse. I take blood pressures just to make sure my patients aren't going to pass out, but I'm not assessing on a regular basis like Kathy or Stephanie are, and maybe some of you also as well. But because of that arterial stiffness increasing, as the heart pumps, the vessel can't expand with every heartbeat. So it's stiffer, which can add to some of that increase in blood pressure as well. And then increases in not muscle, but muscle and visceral fat mass. So within the muscle itself, some of that muscle that maybe decreases in size or atrophies, as we say, is taken over by adipose tissue or fat mass or some fibrotic tissue. So when that muscle fibers are replaced with this fat mass, there's not enough fibers to be able to contract, which also impacts strength and that lean mass muscle area. So you've heard this before. You've heard use it or lose it. And that really, it's a saying, not just because we like to say it, but it holds true. As people become more sedentary or sit more, don't move around as much, they'll lose more amounts of muscle mass than when they were active. And that can add up, especially if we're looking at this 6% per decade loss of lean body mass, especially after the age of 60. We can start to lose some of that body mass, especially as it's replaced by adipose tissue, fat tissue. And so if you think to even normal activities, let's say if you were working, if you're still working, consider how much activity you do on a normal basis. Okay, and then maybe you retired, and the activity that you used to do, you don't have that anymore. And so I know lots of people who have retired who still are very active, but when you stop, and you may know people who have retired and they don't move as much and they become more sedentary, and then they start to have more difficulty with moving around. And so this gets back to what I said earlier, that it's not always about exercise itself, but just physical activity. Okay. And so if we consider muscle mass itself, aerobic activity like jogging, running, elliptical, walking at a faster pace isn't sufficient to stop the loss of muscle mass itself. And so when we think of exercise, a lot of times you think of kind of cardiovascular, what's happening with exercise. But from my perspective, that should be combined also with some type of resistance or functional training. So that's use it or lose it. If you have a hard time getting up from a chair, those are the muscles that are maybe becoming a little bit weak. So we need to work those muscles in a functional way. And typically what we find is, having you just sit and kick your leg out back and forth, it can help that quadricep muscle, but it's a lot more useful to stand up and bend your knees and do some partial squats if you're able, depending on the joint health and your ability to take that with the body weight. That helps the muscle maintain its strength more than just kicking the legs up and down. There's a time and a place for that, but really weight-bearing activities is very beneficial. Also beneficial for bone health. And then again, as we consider balance and flexibility as important aspects of exercise as well. So if our balance is a little bit challenged, or if we feel like we tip or we use our counter as a support system, or I often hear, well, I don't use my cane, but my hallways are pretty narrow, so I just kind of bounce back and forth from one wall to the next, right? Guide, use my hand to guide on the wall. There might be an indication, of course, that the balance is a little bit off. And how do we improve that? Well, we have to practice. And so I want to just review. So with exercise versus physical activity, one of my colleagues, I work with his wife, but he's a researcher at Mayo in the Kogut Center for Aging, and does a lot of research on sarcopenia and aging and health and activity. And he said, it's not so much about going out and doing all this exercise. If you're not an exerciser, it's physical activity, and physical activity is sometimes just as important as exercise. And so this kind of depends on, when I say lifestyle choices here, it means what you elect to do with your time, right? You have, let's say you wake up at 7 in the morning and you go to bed at 7 at night. There's 12 hours in the day. Out of that 12 hours, if we spend 30 minutes doing some type of physical activity or exercise, that's a small component. And so I know patients that will say, well, I can't squeeze it in. Well, what do you do? Well, I watch The Price is Right, and then I watch The Bold and the Beautiful, or Young and the Restless, and whatever comes on next, and The View. And I say, well, do you ever kind of get up and, well, sometimes I got to get up and go get a drink and a sandwich or some snacks or something. And I will say, well, what would you do if you just maybe took some of that time, went out on the deck and just walked back and forth on the deck, or stood at the railing and did some mini squats? A lot of this is, you can dedicate time for exercise, or you can build it into your day. And that's what we really try to do with our patients, and try not to make it so much of a daunting task, especially if they're not used to exercising, or it hasn't been part of their life. So we look at these, household and occupational tasks. If you're busy doing a lot of things, sometimes it is hard to squeeze it in. But if you're getting out, if you're actively participating or volunteering in different services, you're maintaining some of that physical activity by getting out. And then we also, look at what are the hobbies that you have, or sports. And when I say sports, it can be tennis, pickleball. Pickleball. I think are they making a pickleball court here in Rochester? I think I saw something. But any type of physical activity, and maybe it's just going out for a brisk walk, riding on an exercise bicycle, but it's really participating in these activities. So as we consider exercise versus physical activity, we want to keep that in mind, that they're interrelated, but it doesn't have to be considered in exercise, like you're going out and you're exercising. Physical activity, going out for a walk, walking up and down the stairs 4 times. And that can be hard work. When I walk up a few flights of stairs, you don't feel it till you get up there. You go to talk to a nurse and you say, I'm Bryce with physical therapy. I gotta go see this patient. Let me catch my breath first. Okay. So it's a good activity. Now, like I said earlier, there's multiple systems involved in the aging process. I didn't go through all of them. Endocrine system, neuromuscular system, the musculoskeletal. Again, there's some crossover between neuromuscular and musculoskeletal. The hormonal system, integumentary system, bone, cardiovascular, pulmonary. So all of these systems play a role in aging and in muscle health and bone health. There's not one, golden ticket or pill we can take to help them all, but there are supplements and things that we can do to assist with some of these. In my field in particular, it's physical activity. With any status that you're in, normal aging, we really work with our patients who've had stroke or brain injury or spinal cord injury, that physical activity is still very important, if not more important, after an injury, to be able to improve strength, balance, stability, and overall health. And so physical activity itself isn't just physical, but it has its impacts on emotional health and well-being, right? So they talk about being able to get outside, go for walks. They talk about exercising and feeling better after you've exercised. And part of that is just plain old, the body systems in response to exercise are heightened. And so you might feel a little bit better, right? And if you're in a better state of physical health and activity, you'll feel better as well. Mental health, physical health. And some of this can also relate to the up and active, the faithfully fit, class. Part of it is the physical activity, but I bet there's also a part that, there's a huge chunk that is enjoying the social aspect, the camaraderie of doing these activities together. And that also helps with the overall well-being through the physical activity. And so, I just have a couple more slides, and then I'll open it up to some questions. And the reason I'm not saying here's what you have to do is because it's really specific to you as an individual. Finding what's gonna work for you, because if I tell you that you should pick up a tennis racket and start to go play tennis, and you've never done that in your life, it's not gonna be worthwhile for you. It's not going to be good. It might actually be harmful. And so if we think about exercise and activity prescription, it can come in many different ways. So general activity, as I've mentioned all along, being able to mobilize around the house. If you feel like, oh, I'm doing a lot of sitting, well, maybe every hour we get up, we do general activity. We go up the stairs, we come back down the stairs, or maybe you set aside and you say, oh, I'm going to do the steps. I'm going to go up and I'm going to come down. I'm going to do that again, because that's a little bit more strenuous of an activity, but it's not the same as trying to go for a run. But you still work the muscles and you still have physical activity. Believe it or not, I would say, doing laundry, folding laundry, standing, all these activities that you're doing can be part of physical activity. Okay. Gardening, if you like to garden, going on walks. So we're getting into the next section here with aerobic. But when we talk about aerobic exercise, you don't have to get into that maximal heart rate zone. Okay. And so It can be walking. If you're walking slow, but that's your top speed, hey, it's physical activity. If you start increasing your speed and you find that it leads to greater instability, then we need to talk about what ways can we continue to progress with the speed of your walking, but also keep you safe. And that's where we might say, you don't need to use a walker when you're in your home or when you're walking around. But if you're going to get out on the trail and you're going to try to walk fast, maybe you have a walking stick, or maybe you take a cane, or maybe you take a four-wheel walker if you just want to really get out there and cruise. And for me, I have a preference for walking over ground than walking on a treadmill. But if you have a treadmill, especially in Minnesota, winter months, getting on that treadmill, if it's safe to do, is okay. And the reason I say that is because the treadmill moves under the person. So if for some reason you catch your toe or you stop, you keep going because the treadmill keeps going. Okay, there is a stop button, but by the time it stops, you're already at the end of the treadmill and maybe slipped off, or maybe your feet have gone out from under you already. And so if you have the railings and if you're comfortable, treadmill is great. But I do prefer overground running or walking because it gets you out, gets you on different terrains, it gets you on different surface, and it gets you fresh air. Jogging and sports. Now, you don't have to jog, but if that's something that you like to do, that is another way to get aerobic activity. And when I say sports, that's very broad. It's not joining the soccer team or the basketball team. It could be, like I said, hitting the beach ball over the net with your grandkids, right? Something as simple as that. And so aside from the aerobic, then, as we talked about, aerobic activity is not going to delay or prevent the loss of muscle mass, but we can help improve on some of that by adding resistance training. And there's always a question of, is one set enough, or should we do a few sets? With resistance training, it doesn't need to be hitting the gym, doing leg squats, putting on weights. That is one way to do it. But depending on where you're at, resistance training could be the stairs. It could be repeated sit to stand, where you sit down, you stand up, you sit down, you stand up. Okay, because you're pushing your body weight against the ground. So you are doing some resistance activities with that. But adding weight resistance to your activities is a great activity. For the upper extremities, working your biceps, triceps, shoulders. I say shoulders more than biceps and triceps, because shoulders help move the arms. Biceps are important, but they're not as important as your shoulder health. And then your hip joints, the muscles surrounding your hips and knees are important to hit with resistance. Flexibility, we consider stretching, static stretching, more so. We don't look at bounding stretches, but there is stretches through movement like yoga, Tai Chi, that both work with flexibility, but also balance as well. And so when we consider balance as an activity, there's static balance where you're just standing still. Maybe you start with your feet apart, then we move our feet together. Now we're going to move one forward a little bit. Okay. Then there's a more dynamic balance. Okay, we're going to step sideways. We're going to step the other way sideways. We're going to walk backward. Okay, I find in my clinic, the first time I ask somebody to walk backward, they say, whoa, I don't do that a whole lot. That's harder than I thought, right? To just plain old walk backwards, because you have to think about your stability. You're working your muscles in a different way, but multi-directional walking and stepping is really important for your overall balance and health. And if we think about, how much we want to do this, typically we're looking at, 30 minutes. It doesn't have to be all at one time. You could do 15 minutes in the morning, 50 minutes in the afternoon, but 30 minutes in any given day, most days of the week. So really we're looking at 5 out of 7 days of the week. But if we can only get in 3, we'd rather have you get in 3 than none. Okay, so shooting for that 30 minutes of physical activity, at least 5 days a week. And most of us don't have a heart rate monitor. Well, if you have one of those fancy watches or Apple watches, you might have the ability to look at your heart rate. But thinking about how hard you do the activity is this intensity, this Borg scale. It says Borg scale 12 to 14. And that's right here. And so if we're considering where we want to be working when we're doing this activity, working in that 12 to 14 range. So that's a little bit more than fairly light. It's a little somewhat hard, but you're not in that zone where it's, oh, this is hard work. Okay, because if it's hard, you're probably not going to last for 30 minutes doing the activity. But trying to get 30 minutes into that zone where you feel like, yeah, I wouldn't do this all day long, but incorporating that into your day. And so in summary, I want to stress the point of physical activity. And Gloria, I'll get to you in just a second here. Okay.
No, that's brown. I just was rubbing my eye and
Oh, okay.
That's what happened.
You raised your hand on the on
yeah,
the
my eye was itching. I just rubbed it.
Okay, no problem.
Sorry about that.
No. On the iPad, there's a way you might have bumped it with your finger, and then it shows
sure.
a little hand in the corner.
Yes, so, I noticed that.
Anyway, so depending on where you're at, exercise might be too much to consider right now. It might be scary. It might be like, I can't exercise, but I want to emphasize that it's more than that. It's physical activity. Find where you're at. If it's difficult, maybe you do it and say it's hard for you to walk from one side of the house to the other. Okay, well, maybe you do that, you take a little break, and then you go back again. So instead of taking off a big bite, a big chunk, break it into smaller component pieces that will slowly over time add up. Okay, it's just like somebody who's training for in a marathon. You don't start by running 26 miles, you run 2, right? And you run 2 again, and maybe you run 1, and then you run 3. So it's figuring out what your capacity is, and then saying, well, here's where I want to get. Instead of trying to do all that at once, you break it up into smaller component parts, okay? And so, and trying to get that 30 minutes of activity in, 5 days a week, and realizing and recognizing that there's multiple systems that change with aging, but getting back to one of my first discussion points was the idea of sarcopenia and a loss of muscle mass and function and physical strength. And so in sarcopenia, some of the big topic is exercise and strength training. And just like what I've reviewed with you here today is physical activity, exercise with some resistance training can help reverse to an extent, but also maintain the muscle health with aging, especially as we get up into the 8th and 9th decades of life, where we've lost more mass. If we can maintain that and improve on some of that, that will help significantly. And all this, of course, as it relates to function and quality of life. You may win a medal or an award for going out and running the fastest 100 in your age group, but really it's, can you do the things that you want to do? Okay, can you get around the grocery store? Can you get up and down the stairs? Can you get up and out of a chair that's low? Can you go hiking? If you want to go hiking, can you walk around the lake or down by the path? So essentially, that 30 minutes is kind of a key time frame to look at in terms of exercise. But I'm gonna turn off. I think that was my last slide of my PowerPoint. I know, like I said, it was a brief PowerPoint that I took a little bit of extra time discussing. But I'd like to hear from any of you on questions or thoughts. Like I said, I'm I primarily work in neuro, but with neuro, we work a lot with exercise in general as well. Great, no questions. I'll see you tomorrow.
Yeah.
No, I'm just-
I have a question. While doing physical activity, I find I'm more aware of my muscle mass in my core, my abdomen and my core. If I try to maintain posture and keep my, maybe it's proprioception or my balance, but I try to maintain a sense of posture. Is not that I'm trying to burn more calories or strengthen better, but in fact, it's just a feeling in me. Is that in fact more optimal for strengthening as well?
Yeah, I think, being aware of your body and what's, how does it feel when I'm in a position like this? And it's typical also with aging, just with decrease in bone mineral density, the disc. We have discs in our back. You've probably heard of somebody who ruptures a disc. It's kind of a rubbery material with kind of a gelatinous substance in the middle. But over time, those discs kind of shrink up, which causes you to lose height, right? That's where a lot of some of that height loss comes from, and become a little bit more forward bent. So if you can consider bringing the shoulders back and pulling in your abdomen, your core plays a major role in your ability to function at your hips and proximally at your shoulders and trunk. So when you go to move, and maybe you should all do this, when you go to stand up, when this is all done, I want you to think about what your body feels like when you go to stand up. When you go to stand, feel your body. Did I kick my abs in? Did I pull them in? When I went to come up, did I use my back extensors? And engaging those muscles. So if you have back pain, or you're finding that it's really hard to get up or to move, or to stand for long periods, sometimes it's your core. If your tone, your normal resting contraction of the muscles is lower, and you've let some of the weakness develop, I shouldn't say let, it just sometimes happens. Think about just, I would say, tightening your core a little bit, right? Maybe drawing your belly button back in and try to hold it there a little bit, and then you can kind of relax. So you can kind of be aware of what is a muscle contraction like in that area. And am I doing it when I need to be doing it? So I think it is important to do that. And I don't know if that answered your question, Bobby,
Thank you.
directly.
Mhm. Mhm.
Okay.
Thank you.
Yeah, because when you're using your muscles and thinking about using your muscles, they stay engaged. And part of some of the neuromuscular loss is when you don't use the muscles as much, the nerve says, well, I don't need to use this fiber. So the muscle, the nerve actually kind of pulls back from the muscle, and that fiber isn't connected anymore. So that's where the use it or lose it comes in as well, is when we don't engage those muscles, the nerves decide they're not going to make the connection. So they'll pull back a little bit. Not all of them, but there's tens of thousands of muscle fibers, but some other difficulties. So
It's just one thing I want to accentuate that you talked about, that we see so many people who are aging and are cardiac patients, is that people, like you said, think they have to exercise like a marathoner. And just to reiterate your point, even if they can't do 30 minutes, if they do 10 minutes, 4 times, 3 times, or 4 times, and just around the house, just to get moving, that can make such a difference, in keeping swelling in their ankles down and keeping their blood circulating. So I think we always hear about these marathoners, which is a whole nother, people that marathon have to have activity to relax. Relaxing activity, because it's a job. But just to let people know that anything works, anything helps, because I think it can be discouraging if they can't do what they think they're supposed to.
Yep, I think that's a good point. If you don't know where to start, just start by
Yes.
Just start moving, right? I have this shirt. I don't know if you noticed it. This is a shirt. It says,
Oh, movement.
movement is medicine, right? And I don't know, is it coming out straight or is it backwards? It's
Yep,
backwards
nope,
on my
it's
screen.
straight. It's straight.
That's neat.
So, we say movement is medicine. We say motion is lotion. Okay, so, if you get stiff, well, you got to move. Moving can help loosen that up. And, I experience this too. If I'm sitting for too long, or you're in the car for a while, or you're getting up in the morning and, oh, it's hard to get things moving. But as you get moving through the day, generally that starts to loosen up. So, the more you can do that, throughout the day. And, I mentioned breaking it up. What I'll tell my patients sometimes is, if you're not one to say, I need to block this time for exercise, space it out in your day. You put something in the microwave for a minute, work on your balance next to the counter while you're waiting for something in the microwave. Okay. You're waiting to do something, or there's a commercial on, stand up and sit down 5 times. Right. So there's lots of small snippets of time that we can incorporate activities during our daily activity and routine, rather than thinking about, it's really hard to say, okay, I need to sit down and I need to do this for 20 or 30 minutes. But, do it here, do it there, do some squats. It's a little harder to say, get into that, cardio range where you're going out for a walk. You need to plan that. But hopefully as the weather gets nicer, getting outside gets easier as well.
That's a good idea.
Maybe some of you could share what you do for your daily activity. I think that's important because we're all different ages. And what are some of the things that you do?
I have a question for Bryce. This is Darlene.
Yeah.
And I have a lot of balance problems due to being lightheaded. Are there specific exercises that would be good for that?
So I guess my question would be, lightheaded when you stand up, or dizzy, like?
It's lightheaded, and
Lightheaded.
I passed out 3 times since September.
Yeah. So that, that's a combination of physical activity, and then also making sure, and you've probably heard this from a doctor or a nurse, staying hydrated, because your blood pressure, even though I discussed how the blood pressure can elevate for a number of people, it also can drop and be a little bit more sensitive to position changes. You stand up, you get lightheaded, you need to sit down. So you can do some sitting activities to try to prep yourself, like thigh squeezes, straightening your legs, trying to squeeze your thighs, pumping your ankles, because if you sat for a while, the blood kind of settles down and your body hits this state of relaxation. If you're relaxed and you haven't been, getting your heart rate up before you stand, your heart rate can't start up as quick to accommodate for the drop in blood pressure when you stand. So before you do that, sometimes tensing, your abs, or trying to think about squeezing your abs as well before you stand. And then when you do get up, kind of, holding on to something and trying to pump your ankles a little bit can potentially help. But aside from that, and this is something you don't have to say, but sometimes doctors might recommend like a compression stocking just to help with some of the blood pressure as well. And also asking a physician if there is anything. Sometimes they like to do an assess for postural hypotension, or when you stand up, some people's systems, the autonomic system, also with aging can be reduced. So we see a little bit more of this lightheadedness with standing, especially if you don't have as much hydration. So drinking water. But in terms of specific exercises to help with the dizziness, again, it's I wouldn't say specific to the dizziness, but more the muscle activity to try to support your blood pressure. I don't know if that answered your question entirely, but some of these questions, again, there's a mix. Physical activity will help, but there also, you probably want to, discuss with a physician to see if there's something with the autonomic system as well.
I have been diagnosed.
I'm sorry, what was that?
Can you arrest the progression of arthritis, or is that something that's going to continue to get worse with age?
Yeah, arthritis is a little bit difficult. It's individualized. As you know, not everybody has the same arthritis or the same extent of arthritis. And this is where, when I was talking about exercise and physical activity, everybody has to find where they're at. If sitting to standing 10 times is hard because all of a sudden you've done that and now your knees hurt so much, well, then we got to tone it back a little bit and do a slower, less of a bend. Physical activity can help in terms of the idea that motion is lotion. We talked about movement can help lubricate the joints and help make it easier for mobility. But again, arthritis, and there's lots of different kinds of arthritis, and there's also other underlying causes that impact arthritis. I wouldn't say it reverses from where it's at, but physical activity can help maintain. That's what sometimes the first line of defense if somebody's considering, well, their knee hurts, they usually see therapy for some exercises to try to maintain that health. And then, eventually they might need a joint replacement. But the best thing is just physical activity within, I would say, your tolerance or your ability to do the task that you're trying to do. So it can help, but it's not going to entirely prevent the onset of arthritis. That's also part of natural aging in the musculoskeletal system. Sometimes it depends on the extent for individuals. I know my patients always ask a question and I say, well, it depends. And patients really love hearing that, because then I'm not going to give them here's what you need to do, because everybody is very different. Everybody's body is different. Their body system is different. And so somebody who has rheumatoid arthritis is different than psoriatic arthritis, is different than general arthritis. So it is good, Herb, to continue to do activity, but it won't take back time, right? Does that make sense? It won't necessarily.
Yeah, I guess so. That's what I expected to hear.
Okay.
Darn, huh?
Did somebody say darn?
Me, I did.
Oh, yeah, yeah.
But I
Yeah.
have Betty, I just applaud her all the time. She does a wonderful job of going out and walking, as every day, rain or shine, just to keep her stamina up. And I just think you're a good example, Betty, of how that's really helped your stamina stay status quo through your illnesses. And I just keep going back to the fact that anything, I really love your expression, movement is medicine. How true is that? I think we just sometimes expect too much of ourselves. And like you said, just start, just do it.
Just do it.
Start somewhere, huh?
And you just mentioned something, Kathy, and this was, like you said, another potential topic of, physical activity through health and illness, not necessarily wellness, but, we're getting people up in the hospital that are pretty sick, and we need to do that, because if we don't, that's where we start to start some of that loss of connections, sometimes loss of muscle mass, which then impacts function. It's kind of a cycle, right? So I'm too weak to get up. So I can't get up very much. I don't get up very much. So I become a little more deconditioned. I'm a little deconditioned, so I become a little bit weaker. Well, now I need help to get up, and I can't get up. So I don't get up as much. Now you see we're back around again. And so it is kind of a cycle. And part of physical activity and exercise is trying to break that cycle. And I'm trying to be general, but everybody has to figure out what that point is and what that ability is and what that level is based off of their own body. And it's okay to try to push it a little bit if it's safe. And when I say push it, it's I'm going to maybe walk a little further. I don't want you to go and hop on a treadmill and say, I'm going to try to run again. Not a good starting point, but just starting with activity and going to the Faithfully Fit class if you can, right?
Yes, I think that's probably, Jan does an excellent job of
Yep.
working with us more mature adults. And we do, everything you've mentioned, she basically does cover in that class.
Mhm.
So,
I figured I'd be preaching to the choir because I know Jan covers a lot of this and talks about that in the class, but hearing it from somebody else is always a good thing, right?
Mhm.
Yes, I appreciate it. It just confirms what I'm telling them, and
yes.
I can continue to preach to
And
them.
a big thing is the balance, I think. I certainly do notice that now, walking outside and here. It's a lot of balance.
That's one of the things we've been working a little more on lately in class. That everybody has asked for it, so I've been incorporating more
Good.
those exercises.
And sometimes what I do for my patients who are starting off on balance is, park a chair right next to a counter or a table where you can put your hand on it,
Yeah.
stand up, and I say, don't take your hand off, get in the position you want to get in, then slowly go down to one finger, then see if you can take your hand off. But if you start to feel unbalanced, don't feel bad about putting your hand down and resetting. That's okay. I don't want you to fall trying to do your balance exercise, right?
That's what we do.
Good. Other
They
thoughts or
moan and
questions?
groan.
Moan and groan. That's okay. That's okay. That's part of it. That's part of it. That's part of that emotion is medicine. Oh, I got to go up. Oh, all right, let's go again. Mhm. Even young athletes do that when coaches say, okay,
Mhm.
do another line drill, oh, okay, we can do it again. But their systems are, like I said, much more robust. I think back to when I, was running, I could run a mile in 4 minutes and 20 seconds, back in college. And I can't hardly run a mile in twice that now. So that's just even at almost age 40, there's body changes that do occur. And I'm out of shape too, because I haven't been running for many years consistently either. So my physical activity is, I walk almost a half mile from where I park my car to work. I walk around the hospital a lot. I do stairs. I do sit for a few hours when I have to do my notes, and that's the hardest part of my day. And then you're up and moving again. You're walking around. You're walking back to my car. So one easy way you could increase activity is, and this is what I'll do if I'm going to Hy-Vee or parking lot, I don't take the first parking spot I see. I'll probably drive up a little bit further, and I say, well, I have legs and I can use them still. But if you're looking to, increase some activity, maybe it's taking a parking spot 2 down and just saying, I know it's a little further, but that gives me 20 more steps, right? Simple things like that can add up without really even trying.
Right.
I know I've spoken for a fair amount already.
No,
tonight.
it's great
Anybody else?
information, and I'm sure we're all just thinking, are there any other questions that Bryce brings to mind about your own profession or your own personal activity program or something else?
You mentioned Tai Chi as a form of physical activity. And it seems other than adding real strength, I think it adds to the other components of muscle movement, joint and muscle movement, and also relaxation. I know when my husband and I were in cardiac rehab, it was a real pleasure to join a class in Tai Chi. I think it was 8 movement or 10 movement, but it was very relaxing and good for our breathing and range of motion.
range of motion, balance while moving. You know, you're not just standing still, but you're switching your weight, you know, from side to side. And so, yeah, it's very good. You know, if there's any classes like that.
There's a gal that's taught Tai Chi up at CC Heights for years, and a friend and I, after the first time we retired, went to a class. There were 2 16-week sessions. And I, like Bobby said, it's just amazing how your endurance builds, your balance, you know, circling the bowl, you know, all these, you know, different contortions that you just don't do. And her name's Judy Truesdale, and she also offers a class up in the orchard at a CZ Heights all summer. If it isn't raining, she has it. And when it's outside, she doesn't charge. And the charge is pretty minimal for the 16-week program. But it was just amazing to me how much that really builds your stamina, and and it's fun, and it isn't a lot of hard work, but you use muscles, like Bryce has said, that you just don't realize you've got. Or I hadn't used them for a long time. Anybody think of anything else? This has been wonderful, Bryce. We really appreciate your time, and at a time when I know your time is really valuable, and it gives us a lot of food for thought. And I asked him later in the year when his dissertation is done, and maybe he has a few minutes of breathing time, I thought maybe we could have him talk about physical therapy through illness and recovery, or whatever he wants to call it, but kind of comparing what we can do every day to keep ourselves as healthy as we can, to when a person has to undergo surgery or treatments and has an illness, and what they can do then to strengthen themselves and get back to their baseline, because that can be a lot of work too, obviously.
Mm-hmm. Yep. So key take home is keep moving, keep moving. Keep
Movement
moving.
is medicine, and motion is lotion.
Movement
is lubrication.
Motion is lotion. Think of the Tin Man, you know, when
Yeah, I
the
do.
man stops moving, you start to seize up a little bit and it gets stiff. So, you know, you get it moving a little bit. There's natural lubrication within your joints that with movement continues to circulate, but without, it just kind of sticks there. So that's part of the getting rolling in the morning sometimes too, with some of the stiffness, or if you're in a sitting position for too long, it's those joints are in the same position. So trying to get them moving. So, but I do want to thank you all for bearing with me tonight, and hopefully I didn't put too many of you to sleep. If I did, hopefully that was good for relaxation.
Yeah. Any last minute thoughts? There's 2 things I want to do before we end. Any other thoughts for Bryce?
Thank you.
Oh, it was wonderful. Well, 2 things, just to let, before we thank him again and have a closing prayer. Our next meeting is slated for May 9th. And Barb Schroeder, who has spoken with us previously on gratitude, has put together a new program on how happiness happens. And she's basing it on a lot of Max Lucado's work and a lot of scriptural input. And this will be the first time she's presented it. And Barb's done a lot of programs across the country on happiness. So hopefully you can join us, you know, finding happiness in some of the tougher times and what brings us joy. And